Did Dr. Robert Malone correctly claim in a speech that COVID-19 vaccines are not working, that they cause infertility and that vaccine makers are protected legally while families are not? No, that's not true. The vaccines have prevented serious illness and death for millions. Studies have shown the vaccines do not cause infertility and there is a compensation system for adverse effects proven to result from the vaccine. Malone made the claims during his speech at the Defeat the Mandate rally in Washington, D.C., on January 23, 2022. Twitter permanently banned him in December 2021 for violating the platform's COVID misinformation policies. Lead Stories has reported Malone has made numerous false claims about COVID vaccines. These recent claims originated in a video published by Rumble on January 23, 2022, titled, "Am I Dr. Robert Malone's Full Speech?" which opened, "And please allow me to introduce my fellow warrior, Dr. Jill Glasspool Malone." Users on social media only saw this title, description and thumbnail, quote, "Am I Dr. Robert Malone's Full Speech? Subscribe to Il Presidento's Rumble channel here. https://rumble.com/c/ildonaldtrumpo." The Chiron label on screen, on the 1430 video identifies Malone as the inventor of mRNA and DNA vaccine technology. However, the MD pharmaceutical experts claim that he invented mRNA vaccine technology is not recognized by independent authors writing about development of the groundbreaking method. Let's break down several of the false claims he makes throughout the speech. At 3:11 in the video, Malone says, quote, "Regarding the genetic COVID vaccines, the science is settled. They're not working. They are not completely safe. Now we have Omicron. These vaccines were designed for the original Wuhan strain, a different virus." End quote. The Centers for Disease Control and Prevention says the COVID vaccines are protecting against the new Omicron strain. Quote, "Current vaccines are expected to protect against severe illness, hospitalizations, and deaths due to infection with the Omicron variant. However, breakthrough infections in people who are fully vaccinated are likely to occur. With other variants, like Delta, vaccines have remained effective at preventing severe illness, hospitalizations, and death. The recent emergence of Omicron further emphasizes the importance of vaccination and boosters." End quote. Eric Topol, director of the Scripps Research Translational Institute, tweeted the significantly different COVID death rate of those with a vaccine and a booster, and without a vaccine. Quote, "How to reduce your chance of dying from COVID by 99%. Get vaccinated and a booster." One of the most impressive graphs I've seen for the impact of vaccination in the U.S. pandemic. Thanks at Redouat at Our World in Data for replotting my makeshift graph from earlier today. pic.twitter.com/mept06zg5. Eric Topol. At Eric Topol. January 24, 2022. End quote. The website Our World in Data shows the difference in this graph. Image source: Our World in Data website. Screenshot taken on Wed Jan 26, 19 hours 33 minutes and 43 seconds 2022 UTC. At 8:48 in the video, Malone says, quote, "In contrast, the pharmaceutical companies and the government are almost fully protected from any damages these products might cause to them. If your child is damaged by these vaccines, you will be left alone with both your grief and the burden of care." End quote. Peter Myers, professor emeritus at the George Washington University Law School, who was previously the director of the Vaccine Injury Litigation Clinic, told Lead Stories via telephone on January 26, 2022, that Malone's comments regarding the pharmaceutical companies and the government are, at the very least, misleading. Quote, "That is inaccurate. The accurate situation is the federal government passed a statute called the PrEP Act, which says that if you believe that you or a family member have been injured by the COVID vaccine, you cannot sue the manufacturer unless you can show that the manufacturer has engaged in willful misconduct. If the manufacturer of any of these COVID vaccines has engaged in willful misconduct, which is a high standard, but that could be suppressing information about the vaccines, about its possible harms or other acts in manufacturing the vaccine, if they did engage in intentional misconduct, you can directly sue the manufacturer." End quote. Myers cautioned he had not seen evidence of intentional misconduct on the part of pharmaceutical companies or the government, saying, Quote, "I think that's unlikely and I know of no evidence to date which would indicate that any of the COVID-19 manufacturers have engaged in the intentional misconduct with respect to either producing the vaccine or getting it approved by the federal government regulators, or in distributing it or making false claims."